Why do muffins have to share with cherry pie? I don't understand. All right, welcome back to Western New York Living. With most of the medical news this past year centered around COVID-19 virus and the COVID vaccination, it's not a surprise that some people have neglected certain aspects of their health. It could be as simple as delaying an annual physical or screening. Dr. Chen from Windsong Radiology joins us this morning to discuss why it's more important than ever to maintain healthy habits. Dr. Chen, nice to see you. Thanks for being here.
Thanks for having me.
Well, as I mentioned, screenings, and your focus at Windsong Radiology is breast imaging. Why is breast cancer screening important during a pandemic, and why should women make sure they receive that annual exam?
Breast cancer screening in general is just important for every woman. Just because the earlier you find a cancer, the better the prognosis and survivability. The pandemic, even though it kind of slowed things down a little bit and made things a little more complicated for patients to get their screening study, most places have made proper adjustments for safety of patients to ensure that they can get their screening mammograms safely. And it is, again, been found that screening mammograms are important to have yearly to increase detection and improve survival.
I know we've touched on this in the past years. We see some of the safety measures put in place here with staff wearing masks and some of the plexiglass there. Who should be getting the mammogram? What age should women start to get their annual mammogram?
A majority of women who are at average risk, they should get baseline mammograms starting at the age of 40. And then they should continue with mammograms yearly from that point on. If patients have been found to be high risk, they may need to start screening earlier. We do recommend, if patients have questions if they are high risk or not, that they could seek a genetic counseling to find out if they are high risk or average risk.
The other question, and self-exams, and women may find a lump. What should they do if they find a lump at any age during a self-examination?
If a patient finds a lump, first, they shouldn't get overly alarmed, but obviously they should get checked out. So the first thing they should do is they should contact their physician and have the physician take a look at them so the physician can get a baseline physical exam and see what the problem may be. And then most likely the physician will send them to an imaging center for some sort of imaging. There's lots of different imaging that can be done. Typically it's an ultrasound and a mammogram as the first imaging. If a patient has a problem, it's kind of different from a screening study where screening studies, patients don't have any problems, signs or symptoms. So if a patient has a problem, they should seek immediate help from their physician and have imaging, whether or not there's a pandemic or not. You know, that's what should be done regardless.
And final thing, we saw some images there of some plexiglass up and masks. What are some other things that you're doing for patient safety so people who might be reticent about coming in for their annual exam?
Well, we want to reassure patients that we've made Windsong a safe place. We do interview questions for when patients come in, as well as temperature screening. We do require masks. All of our staff, as well as patients, are required to wear masks, and we do provide extra protective equipment for our staff that have close contact with patients. We are limiting to only patients in the office, unless obviously they have a caregiver that needs to come with them, just to limit the number of people that we have in the office.
Yeah, it makes sense, and great precaution. So no reason not to go to get that annual exam. Dr. Chen, thanks so much. Windsong Radiology takes pride in being a local leader in breast imaging. Their main offices are located at 55 Spindrift Drive in Williamsville. They also have offices in Amherst, Hamburg, and Lancaster. To find out more about all the services they provide, including breast cancer screening, head over to their website at windsongwny.com. You can also give them a call at 631-2500 to speak to their helpful staff. It's Windsong Radiology, where patients come first. Now, coming up next, if you've noticed the insulation in your house isn't up to par these past few weeks, Ivy League Construction can help. They'll be here to discuss that topic and what's new and stylish in exterior siding when we continue. Stay with us.
This segment of Western New York Living was sponsored by the following: